Welcome all. Welcome to this AimExcellence NRMT question answer discussion. And we have uploaded this particular question. Patient on proton pump in a feature came with diarrhea. In lab examination of stool sample, this motility pattern is seen. What is the drug of choice in this condition? So before getting into that answer, see this particular motility pattern. You can see the motility pattern of the trophozoite out here. And this is fallen leaf motility. This is known as fallen leaf motility, which is seen in cases of Giardia intestinalis or lamblia. So here you have to tell about the drug of choice, and the drug of choice is metronidazole. Now you have to remember, if it is a USFDA question and tinidazole is also the option, so you have to give the answer is going to be tinidazole. Because it is, according to the USFDA, tinidazole is going to be the drug of choice. Now we are going to discuss two more questions regarding giardiasis. These are the new questions and interesting ones. So the best test to detect giardiasis is A. Hydrogen breath test, to B. Microscopy to detect trophozoite, C. ELISA, D. Entero test. And another is Giardia protects themselves by reducing four options again given out here: carbon dioxide, carbon monoxide, nitric oxide and nitrogen dioxide. You have to pick one of them. After studying Giardia for so long, seeing the cyst and the trophozoite and all the pictures, this can be the question in front of you, because it is not necessarily is going to be a microbiology question. It can be a clinical medicine question, and that is why it's very important to see the integrated medicine discussion. Now here the answer is going to be ELISA. It is the more sensitive according to the CTC. It is having 90% sensitivity. Far more sensitive in detecting giardiasis than microscopy to detect the trophozoite or cyst, which will remain the gold standard, but investigation of choice right now is ELISA. And it is wrongly given in many guidebooks. So in integrated medicine discussion, we go for the actually latest informations. So this is the investigation of choice. Giardia protects themselves by reducing which of them? What happens in Giardia? They consume all the arginines, and as we know, arginine produces nitric oxide. So the nitric oxide level is going to be less than, which is going to be pro-apoptic. So this is the answer. Now what is Entero test? There is going to be gelatin capsule that is going to be put in the cheek of the patient, and on one side of it is going to be a thread, and patient is going to ask to swallow it. After swallowing, again the capsule is going to be pulled back, and then after from that capsule you have to see whether you can find a trophozoite. So that test is known as entero test. It is also done to diagnose giardiasis. These are the interesting new informations. Now regarding the giardiasis and giardia, few things are very important. 10% cases are going to be asymptomatic. Giardiasis is a flagellate. Flagellate means the protozoa is going to be with the flagella. So it is having two forms. One is trophozoite and another is cyst. Both have flagella. The cyst is going to be quadrinucleated. Cyst is going to be quadrinucleated, whereas trophozoite is going to be tennis racket shaped with two nucleus. So one important symptom generally you will not see, and if you find in a patient, then you have to think of other diagnosis, other condition. Fever is generally not seen, and it's a very important factor. You can see weight loss in cases of chronic diarrhea. It can lead to dehydration and weight loss, but fever generally not seen in cases of fever and dysentery, as because it's not invasive. So fever and dysentery is not generally seen in cases of giardiasis. Hope you like this particular presentation with the added informations. More we are going to talk about giardia extra point in our TNDs, and till the World Cup is over, we are not going to upload more questions as because many of you have said to upload the question after the World Cup. So let it be so. We are going to upload the question more frequently from September onwards. Till then, enjoy the World Cup. Hope India wins. And if you like this particular presentation, this sort of presentation, let us know. Thank you.